Hi, my name is Brett Stevenson. I'm a doctoral student at Boise State University studying counselor education and supervision. This presentation will provide information regarding sleep and sleep hygiene. This is part of a larger group of presentations addressing general wellness, and this is part 2. First of all, let's learn a little bit about sleep. While it varies, most people need right around 7 to 9 hours of sleep. You'll hear a lot of people say, oh, I only need 4, 5, maybe 6 hours. But most studies have shown that even those who think they need less sleep would probably operate better and be healthier were they receiving more sleep each night. The most common cause of daytime sleepiness is self-imposed sleep deprivation, meaning people don't go to sleep when they should and they possibly get up earlier than they should. Short-term difficulties with sleep are pretty common. A third of all Americans report at least one night a week having difficulty with their sleeping. Sleep is linked to overall health, of course, as we know, but overall mental health as well. Resolving sleep disturbances very often leads to improvements in mental health symptoms, especially regarding depression and anxiety. First-line treatments for insomnia and for sleep difficulties are lifestyle changes, and we're going to talk about those lifestyle changes today. So a big one is called sleep hygiene. Well, what is sleep hygiene? It's a set of behaviors and conditions that are more likely to allow you to sleep better and longer. Let's talk about these. And the first one is creating a routine. So this means kind of creating a system or a whole set of activities that happen right around bedtime, meaning you go to bed at the same time every night, at least close to it. Especially when you're first trying to really address your sleep problems, it can be important to continue the sleep routine even on the weekends. Weekends tend to be a time when people think they can stay up a little bit later, which is true because they may not have the same awake time due to work obligations, but unfortunately that also can really exacerbate or make their sleep problems worse. It's important to engage in the same activities and relatively the same way each evening if you can, meaning how and when you put on your sleep clothing, taking medications or vitamins, the routine you might have around washing your face or brushing your teeth, even, if you might read a little from a book before you go to bed. One thing to consider is the temperature of your room each night. Sleep, they found, is best somewhere in between 67 degrees and 70 degrees Fahrenheit. And if you have the ability to maybe change the temperature of your bedroom, it might be worth trying that out. Removing screens from your bedroom can be super important. The light from our screens actually kind of sends a signal to our brain letting us know that it's time to be awake. And we have so many of these in our lives right now. These include cell phones, iPads, data pads, computers. Even your TV can give off some of this light that kind of sends signals to your brain that you should be awake. It's really important to maybe try cutting them entirely from your bedroom if you can, meaning even during daylight hours, not using your bedroom for viewing these things. Now, of course, it may be that you're in a dorm room or another situation where that's really the place you do everything, homework, viewing movies, everything. And if you can, make it so your bed isn't a place that you do these things. It's important to maybe plug in your cell phone away from your bed if you can in another room like the bathroom or the closet. If not, then make it sure that it's far from your bed so it doesn't disturb your sleep. And you can also put the sleep settings so that the screen doesn't come on when someone might call you at night. Pets. Now, this is a controversial one. I know lots of people love their pets and really enjoy sleeping with them, yet most studies have confirmed that people generally get poor quality sleep when they're sleeping with their pets. So if you find that your pets are disrupting your sleep and you're able to, because we realize that some pets do need care in the night, it might be worth trying to remove your pets from your bedroom for a while and see if you get better sleep. Caffeine really does influence our sleep patterns significantly. So limiting and appropriately scheduling your caffeine can be really important. More give or take, every individual kind of processes caffeine a little differently, but stopping your caffeine intake 6 hours before bedtime can be crucial, and really reducing your overall caffeine intake can be important as well. Keeping it around 200 milligrams or less each day can be helpful. In the US, we get to see how much caffeine is in all of our beverages. It's required to be labeled. So begin to track your caffeine and see how much you're taking in. Too much caffeine during the day, even taken very early in the day, can lead to sleep disruption at night. And it's hard to know that because sometimes you might fall asleep right away, but then later keep waking up. And caffeine can be one of those things that's causing that. Alcohol and liquids. So avoiding alcohol before you go to bed. A lot of times people will drink alcohol in order to help induce sleep. But unfortunately what it does is actually lead to a poor quality sleep and disrupted sleep. Again, other liquids also. So drinking too much water or anything else before bed might lead to breaks in sleep just because your bladder keeps waking you up. Engaging in physical activity throughout the day can be really important and really does improve sleep. One crucial note is if you can limit your physical activity within 2 hours before bedtime, that can be important because doing it closer to bedtime can actually kind of rev you up and make it so you might have a more difficult time falling asleep. We have a presentation 1, that addresses what appropriate physical activity might look like. Please view that if you have any questions. And finally, check in with your doctor regarding any problems that you have with your sleep. There might be some physiological conditions and some medical conditions that might need addressing. As we said before, this presentation is a part of a larger group of presentations that address general wellness. The other presentations are physical activity, diet and nutrition, maintaining a routine, and social connectedness. Thank you for viewing.